All right, hello everybody. Thank you all for being here tonight. We are going to get started here in just a second. I do want to have our language access team come up and say some quick words before we get started. Who are you? Oh, sorry. I'm Chris Core. I am Supervisor Ellenberg's Communications Director, so thank you all for being here tonight for this event. If you do have any questions throughout the night, feel free to grab anybody with the pink shirt. We'll be here to help you out. But let's have our language access team come up real fast.
Hello, good evening. My name is Diego Tornero, and I'm with the Language Access Unit. My colleagues are sitting here on the right. They're also providing language assistance for this meeting. The meeting will be conducted in English. So if you need interpretation into Spanish, please go ahead and get one of the devices. We also have interpretation for Chinese. Now, I will repeat this message in Spanish. Buenas noches a todos, mi nombre es Diego Tornero, soy parte de la unidad de acceso lingüístico. Mis compañeros están sentados a mi derecha y están disponibles para servir como intérpretes esta noche. Si ustedes necesitan interpretación al español o a chino, por favor, obtengan un dispositivo aquí en la derecha. Gracias.
您好，如果您今天需要中文口译服务，请到这边的桌子来取口译器材，谢谢。
And I do want to say thank you so much to our language access team for all being here tonight. We appreciate you so much for being here. All right, I now want to invite Patty Wong up. She is the Santa Clara City Librarian, and she's going to share a few words about this great venue we have tonight.
Welcome, everyone. Oh, sorry, I'm a little shorter than this, so you'll adjust it later. Welcome, everyone, to the City of Santa Clara and the Santa Clara City Library. If you haven't been here, please, I wish we were open a little bit later for you, but it's a wonderful building and a wonderful system of 3 libraries to serve you, and we're welcome to everyone. We bring about 500,000 people into our community in this beautiful building every year. One of the things I did want to bring to your attention is that 70% of all of our circulation is for children and young people. 70%. That's 1.2 million items a year. And so this community loves its library. This community loves our children and our families, and that's why we're all here. I wanted to spend a little bit of just one commercial, just one. On October 10, we have our signature event for the Santa Clara City Library, and that's our Comic-Con. So we hope that you'll all come. It's from 10 to 5. Everybody's welcome. You're going to have a great time. And we're so pleased to have Susan Ellenberg and her team here talking about what's really important in our county, which is our children and families. So thank you.
All right. I think that means I'm up. And I did note, I'm so delighted to see all of you, but was thinking that maybe the attendance is slightly sparse because it is not raining. And our last 2, you will only get that joke if you had been at the last 2 events, which were torrential rain, but we managed to fill the rooms, and I am really happy to see all of you who did join us tonight, and we are live streaming, so additional folks can watch us as well. Before I start my remarks, I want to recognize and appreciate some of my elected colleagues or their representatives who are here tonight. From the Santa Clara Unified School District, trustees Vicki Fairchild and Jody Muirhead. From Congress member Zoe Lofgren's office, Edwin Sevilla. From State Senator Josh Becker's office, Diana Sunshine. From the Santa Clara City Council, former council member Teresa O'Neill. Campbell Union High School District, trustee James Kim is here. There he is. Sunnyvale City Council member Linda Sell is with us. And I see candidate Mary Grunthaner, who is running to be a trustee for San Jose Unified School District. Did I miss anybody, a candidate or an elected? I can't see that far. Thank you, Kimberly. Candidate for City of Santa Clara Council District 2? Got it. Okay. That's everybody? Fantastic. Let's get going. I'm very excited for this program tonight. So presumably you all know where you are and know who I am, but I am Susan Ellenberg. I am the supervisor, have been for the past 8 years for District 4, representing Campbell, West San Jose, the Burbank neighborhood, and of course the beautiful city of Santa Clara, where we all are tonight. When I took office in 2019, I made a commitment to uplift the children in our county and the families who support them. A lot has changed since those early days. Our community has weathered a pandemic, economic uncertainty, and profound social and political shifts. But my North Star has never wavered, ensuring that every child in Santa Clara County can grow up safe, supported, and able to thrive. Tonight, I'm going to walk through the work that we've done, the challenges we've faced, and the opportunities ahead. And I will begin with the hardest part of the work. Child welfare, and particularly child welfare social workers, have the toughest job imaginable, determining whether to remove a child from their family. There are only rocks and hard places. Removal is traumatizing. Someone has to make a determination that such trauma is outweighed by the risk to that child's safety if they are not removed. And yet, removal doesn't guarantee a child's safety either. Long-term engagement with the foster care system, unfortunately, has led to substandard outcomes all too often. Kids in foster care often become that vulnerable transitional age youth, experiencing disproportionate engagement with the criminal legal system, and are less likely than their peers to graduate from high school, to be stably housed, or to find and maintain work. And many of those kids remain reliant on county services for years. Our systems have not been designed to wrap vulnerable families with every single service they need to remain together. Removal has been viewed as the more expedient, less risky, and frankly, there are often more funds available to support children who have been removed. So let's not kid ourselves that there are straightforward answers or that government systems have failed when tragedies occur. Child welfare is underfunded, and our system has been enormously stressed for the last 3 years as we have weathered 3 unspeakably tragic deaths of children we were supposed to protect. In each case, a multitude of missteps likely contributed to those disastrous outcomes, and our county administration, as well as outside investigators, are examining every single step and decision point and will advise us on where we need to do better and how our systems might be iterated to protect against such tragedies in the future. But at the same time that we iterate, it's so essential that we not swing wildly away from known best practices, even though those practices have, on rare occasions, ended in tragedy. The reactionary swing that our county actually has taken following the death of baby Phoenix in 2023 has not made children safer. We have increased our removals by 181% over the past 3 years. Dependency court is now overwhelmed. CASA, the court-appointed special advocates, has a wait list of over 100 children. The Dependency Advocacy Center, which represents the interest of parents, nearly shut down because of the untenable volume of work. And 2 more children died. So I am not here to preach a particular philosophy on removal. I am here to say that I take extremely seriously the well-being of every child who comes into contact with our systems, and we must do whatever is needed in each case to keep that individual child safe, whatever it takes. It's hard to transition from that smoothly, so I'm going to just take a little leap and note that as difficult as the as the DFCS, that's the Department of Family and Children's Services, under which child welfare is nested, as hard as that conversation is, it is only one part of a much larger ecosystem through the county that supports children. To understand the scope of this work, I want to shift now to the instrument that lays it all out across every department in the county, which is the children's budget. And there are a bunch of them over there. I directed the creation of a children's budget in 2019 to help me understand the totality of county investments and expenditures related to children's well-being across every department in the county. The children's budget has since become an annual publication detailing every program funded through the county's adopted budget that benefits children, youth, and families. It reflects our board's commitment to making Santa Clara County a place where all children can flourish. And we do invest in children across the organization, from child welfare to juvenile justice, programs for young families experiencing homelessness, mental health, including school-based wellness centers and substance use disorder support, a youth task force, our award-winning Intern and Learn program, designated housing for transitional age youth, guaranteed income pilot programs for unstably housed high school seniors, young moms, and former foster youth, educational programs in our beautiful parks, and more. In fact, when the work was brought together, it was so comprehensive that former Supervisor Chavez and I created a new county position, the Chief Children's Officer, and a new office, the Office of Children and Families Policy. And the creation of that office led to a detailed exploration of the impact of the lack of access to childcare that has kept tens of thousands of parents out of the workforce, rendering them more likely to be housing or food insecure, less physically and emotionally healthy, and more likely to be victims or perpetrators of harm. And correspondingly, when parents are forced out of the workforce, employers have a harder time hiring and retaining employees. They see reduced productivity and more turnover. Families that can't work can't afford to live here. And if we can't keep young families in our cities and in our county, then those cities will slowly die. It is as simple as that. Childcare is the infrastructure that girds a healthy economy. I'm going to talk a little bit more about why childcare matters and how big a problem this is for real. The numbers are staggering. Ready Nation estimates that the childcare crisis costs the U.S., money lost, costs the U.S. $172 billion annually. In California alone, the cost is $24.9 billion each year. And this loss is made up of lost tax revenue, less disposable income, poverty, more reliance on social services. It's measured across a dozen or more factors. Families are leaving our cities, employers are losing workers, small businesses are losing customers, and children are losing access to early learning environments that can shape lifelong outcomes. And this is not abstract, this is happening here. But before we can talk about solutions, and I have some ideas, we have to be honest about the challenges facing families in Santa Clara County and across California when it comes to childcare. The challenges show up in the daily lives of parents who are trying to work, providers who are trying to stay afloat, and I see a group of y'all here, and children who deserve stable, nurturing environments. The first challenge is cost. Childcare in California is simply too expensive for most families. Today, a family can expect to pay anywhere from $16,000 to more than $22,000 a year for full-time care, depending on the child's age and the type of setting. And while more than 2.1 million children qualify today for subsidized care, only 16% are actually receiving it. That gap leaves so many families making impossible choices, leave the workforce, patch together unstable care, or go without entirely. The second challenge is the workforce itself. Child care providers are overwhelmingly women of color. They are doing some of the most important work in our community, yet they are paid a median wage of just $16.18 an hour. The executive director of First 5 Santa Clara County recently noted to me in my podcast, which y'all should go watch, that dog walkers are generally paid more than that. Many providers left the field during the pandemic, and the workforce has not recovered. Providers who remain are stretched thin, and new providers face barriers that make entering the field incredibly difficult. The third challenge is capacity. Even when families can afford care or are holding a voucher, and even when providers want to offer it, there simply aren't enough licensed spaces. More than 60% of California's children live in what experts call a child care desert, meaning that the number of licensed slots, and we will talk also about license exempt and family child care homes, is far below the number of children who need care. And expanding capacity is not easy, as you might imagine. Licensing is complex, renovations are expensive, and upfront capital required is out of reach for many small providers. So the challenges are real, but they are not insurmountable. And Santa Clara County has stepped up. Through the children's budget, the Office of Children and Families Policy, and a number of targeted initiatives, we are building a stronger, more equitable child care ecosystem. Tonight, I want to highlight 3 major areas of work that came before the board recently and preview what's coming next. Back in 2022, I brought my colleagues a referral called Santa Clara County's Children's Roadmap to Recovery that was designed to help families and providers rebound from the pandemic and address 3 urgent needs: supporting children who lost a parent or primary caregiver to COVID, expanding wellness centers on school campuses, and strengthening the early learning and child care ecosystem. I'm going to focus tonight on that third element of that referral, strengthening the early learning and child care ecosystem. We did this through the launch of 2 significant investments, one in the child care workforce and the other in child care facilities. So, workforce first. A $10 million investment, half county general funds and half ARPA funds, that was the American Rescue Plan Act, one-time funds from the Biden administration during COVID. That $10 million total allowed us to launch 3 major workforce development programs. And these programs have taught us so much about what it takes to build a strong, sustainable early childhood workforce. The first program we stood up was called the Apprenticeship Initiative. What we learned from this effort was really powerful. When apprentices receive comprehensive support, tutoring, mentoring, technology assistance, they stay engaged. When they learn in cohorts, they persist. When employers are invested, apprentices succeed. And when we create real career pathways, people are motivated to continue advancing beyond those entry-level fields. But we also learned that the challenges facing the early childhood workforce are structural. Low wages, limited benefits, and competition from higher-paying sectors make recruitment and retention difficult. Employers often lack the capacity to provide the supervision and release time that apprentices need. And apprenticeship programs themselves require significant coordination across colleges, employers, and state systems. But even with those challenges, we built a foundation. We partnered with First 5 and 2 local community colleges and built out multiple apprenticeship cohorts, which will graduate nearly 100 new child care apprentices. We recently transitioned leadership of the apprenticeship program to the County Office of Education, which, despite its name of Santa Clara County Office of Education, is not at all directly related to the county. But they can draw down state apprenticeship funds and align this work with other regional pathways. Sustainability will depend on blending funding sources, strengthening employer participation, and keeping higher education partnerships strong. But that infrastructure is now in place. The second workforce program that we created with those funds is called the Shared Services Alliance, which supports family childcare home educators, the small business owners who provide care in their homes and who are essential to meeting community needs. 90 educators participated, receiving legal support, business coaching, quality improvement assistance, and opportunities to join communities of practice. We provided micro grants to help stabilize their businesses, and those grants supported care for 439 children. What we learned from this program is that flexible funding matters. Providers know what their businesses need, and when we trust them with resources, they use them wisely. We also saw how powerful it is when FCCH, Family Child Care Home providers, connect with one another and with system leaders, they flourish. Many become advocates, meeting with legislators, joining statewide councils, and helping to shape policy. And we saw that strong coaching and technical assistance can close equity gaps around language, digital literacy, and navigating complex systems. The Shared Service Alliance is now building sustainability through partnerships with organizations like the Latino Business Foundation, Excite Credit Union, and Working Partnerships USA. Key elements of the program will be folded into Quality Matters, which is funded by Quality Counts California and local Prop 10 dollars. That work, too, will continue. The final workforce development program was called the TK Teacher Equity Initiative. With universal TKs, transitional kindergarten, that means all 4-year-olds, regardless of the date of their birth. With universal TK expanding statewide, we needed a pipeline of credentialed teachers, and we needed that pipeline to reflect the diversity of our community. First Five partnered with San Jose State University to help early educators earn the new PK through 3 credential. 16 educators enrolled, 3 graduated in 2025, 3 of only 12 statewide at the time. 8 more graduated in 2026, including one who earned a master's degree. Several graduates earned bilingual authorizations in Vietnamese and Spanish, strengthening our ability to serve multilingual communities. But this program also revealed real barriers. Many family child care educators were interested, but pursuing the credential would have required them to pause or close their current child care programs, an impossible financial burden. Others did not meet the minimum educational requirements. And even with scholarships, tuition and related costs remained significant obstacles. Navigating college systems, evaluating foreign transcripts, and accessing language supports posed additional challenges. Still, the initiative succeeded in creating a pathway, one that is now producing credentialed TK teachers who reflect the communities they serve. So that's the workforce piece of the childcare piece of the roadmap to recovery. You're all with me? I know it could use a flow chart. Facilities. We recently finished distributing $15 million. That was $10 million from ARPA, that's the federal one-time COVID money, $2 million from our probation department, and $2 million in private philanthropy to more than 50 child care providers. These providers are in the process of and have created nearly 700 new slots, but it is still not nearly enough. We received 499 grant requests. We funded 50, totaling about $85 million. We had $15 million. The Child Care Grant Expansion Program is a drop in the bucket compared to the roughly 25,000 more child care slots our county needs to provide quality care for every family, including those eligible for subsidies, according to 2025 data. But what we showed is that every dollar makes a difference. And even if we had just $15 million, that $15 million has created 700 new seats, and that's ongoing. It doesn't mean 700 forever. It means 700 each year for more children to join. This can be scaled. This is not mystery work. Facilities, workforce, subsidies. We see what works on a micro level in Santa Clara County, and this is scalable. It's scalable to California, and it's scalable nationally. Our own gap reflects a statewide reality, a staggering 600,000 child care slot shortage, meaning tens of thousands of parents likely can't work. That leaves California's economy suffering and creates workforce shortages. Beyond the children's roadmap to recovery, I continue to bring forward initiatives to support children's earliest years. In 2023, I directed a budget inventory grant to First Five to study home visiting across county systems. Home visiting is a voluntary, opt-in, evidence-based service delivery strategy that connects expectant parents and caregivers of infants with a trained support person. Could be a nurse, a social worker, or an early childhood specialist to guide them through those early stages of raising a family. And the findings of that study were super clear. Home visiting services in the county were both underfunded and underutilized. The report also underscored that home visiting is a cost-effective investment, bringing together case management, family support, and critical referrals to other healthcare providers. First Five's report that resulted from my grant identified 4 partnership opportunities. First one is a light touch newborn visiting program, serving families at risk of experiencing homelessness, poverty, and food insecurity. Second is workforce innovation and professional development, including the home visitor professional development pathway, strengthening our cross-system referral infrastructure, and hybrid models that combine clinicians with paraprofessionals. These are practical, again, scalable strategies, and we are moving them forward. Another area where our county has made meaningful, measurable progress is our work to support Black mothers and infants in Santa Clara County. This work is straightforward. Every mother deserves to give birth safely, and every baby deserves to start life with the strongest possible foundation. But for far too long, outcomes for Black families have been shaped by inequities that are both systemic and preventable. In 2021, I brought forward a referral that doubled ongoing funding to expand both our perinatal equity initiative and the Black Infant Health Program. And that investment allowed us to build a stronger infrastructure, one that brings hospitals, both public and private, community partners, and public health experts together around a shared mission. Since then, we have seen real progress. The Perinatal Equity Initiative partnered with Roots Community Health to provide doula services to African and African ancestry birthing people in our county. These services are now billable through Medi-Cal, which means that families can access culturally responsive support during pregnancy, birth, and postpartum without facing financial barriers. That's a big yay. We also expanded behavioral health support by contracting with Ujima Adult and Family Services, ensuring that Black mamas have access to mental health care that understands their lived experience. And we strengthened collaboration with our local birthing hospitals. In 2024, with the Valley Health Foundation, I convened executive leadership from every birthing hospital in the county, along with the Hospital Council of Northern California, for a dinner focused on one thing: data. sharing it, understanding it, and using it to drive change. And that conversation had real impact. Today, PEI tracks 6 clinical metrics across all birthing hospitals in Santa Clara County, something that had never been done before. And because of that data, we can now see the impact of our investments clearly. In 2025, our Public Health Department published findings showing that maternal hypertension, one of the leading causes of maternal morbidity, is 30% lower among Black infant health participants. Another big yay. This is not a small improvement. This is lives saved. That is families kept whole, and that is what happens when we invest in culturally grounded care and when we listen to community members and we treat equity not as an aspiration, but as a requirement. Sometimes kids make mistakes. Sometimes they act unfavorably, even dangerously. Sometimes they perpetrate serious harm. And then they come face to face with the county's juvenile justice system. Obviously, they need to be held accountable, but hopefully just as obviously, we need to recognize that they are children. Children who in the vast majority of cases can be supported to move their lives in better directions if we invest in their rehabilitation, recovery, and re-entry into community. Santa Clara County has long been the standard bearer within juvenile probation. Our department advances youth success through individualized supports, including education, family services, behavioral health care, and maintaining reduced juvenile recidivism rates at 7%, significantly lower than the national average of 30 to 50%, as measured within 1 year of program completion. Our juvenile probation department is helping build better futures and strengthening the safety and well-being of our entire community. But we know that that impact could be even greater if we could invest far more in upstream prevention and early intervention so that no child ever enters the juvenile justice system. Poverty is a common denominator for most kids who enter the system. Poverty begets desperate choices, leads to chronic stress, which makes violence more likely, and this cycle repeats itself generation after generation after generation. So, in response to that, one of my most recent referrals was to create an Office of Violence Prevention within the Public Health Department, because I believe that real prevention begins long before law enforcement comes onto the radar. Violence prevention means secure housing and sufficient nutrition, access to quality health care and child care, opportunities for education and meaningful work, clean, well-lit streets and neighborhoods, and more. Just as we looked collectively at all our children's programs through the children's budget, this new office will review all the ways in which our county seeks to prevent violence across departments to ensure a cohesive, non-duplicative, consistent approach to building safe, healthy communities and adhere to best practices. And I look forward to reporting more on that work in a year or so. Let me look ahead a little bit before I wrap up and take your questions. The Child Care Blueprint is an equity-centered tool designed to identify local policy solutions that support our highest needs children and our most vulnerable families, including families involved in the child welfare system, refugee families, young parents, and families with children of atypical abilities. It works by uplifting the child care needs of families who interact with county services and resources, ensuring that their lived experiences shape policy priorities while also elevating policy goals, strategies, and actionable recommendations from experts in the field that respond directly to family concerns and can be implemented locally. That sounded, as I read it out loud, a little bit like a PhD thesis statement. So I'm just going to restate it, even though I'm so excited about what it is. Our Office of Children and Families policy experts, including our director, Dr. Heidi Emberling, has been working with a team of staff in the county and has done multiple, I think a dozen or more focus groups with users of county services who have very young children to say, what is your childcare situation? What are you using? Is it working? What do you need? What would be ideal? And through the collection of qualitative and quantitative data, so anecdotes and stories as well as, hi Albert, as well as statistics, the team is putting together what they are calling a childcare blueprint. I haven't seen it yet. It is going to be rolled out to the board in mid-September, I believe, mid or late September, and will show us a path forward for meeting the needs of these families. So I am very, very excited to really see what all of that looks like. A tremendous amount of work and investment and community engagement has gone into this work, but I can't say more yet. You'll have to come back. Regarding children's budget improvements, we are continuing to refine methodology, we're aligning investments with outcomes, and we are preparing updates for the Finance, Government, and Operations Committee of the county. I sit as the vice chair of that committee and have directed that the children's budget reports come there so that they are not isolated or thought of somehow as separate from the rest of the county. The children's programs are so intertwined with so much of the work that we do that holistic picture is really the only way that we can do this work and have impact. My work is far from finished. Fortunately, and thank goodness, I have 4 more years in which to get things done. I, my colleagues, and our administration are building a county where children and families are not incidental, but rather the priority and at the center. I want to thank you all very much for listening to my tale of what our county is doing to support and nurture and help and protect and take care of children. And I would be so delighted to answer questions. We gave index cards. If you still need one, we can pass out more cards. If you have a card that has a question on it, happy to get those and somebody will read them to me and I will answer. But thank you very much for your attention. Hi, Chris.
We need to get 2 questions in beforehand, so we'll go through these 2 questions and then we'll look to the audience and I'll pass around this moving mic.
Oh, great.
For anybody who has questions. But
Okay.
We'll start with these 2 we got first. So the first question we had was if you could say a few words about volunteerism. Since the COVID and ICE situation, it seems to have declined dramatically.
Yeah, I think that's true. I think that if the question is about looking for specific volunteer opportunities with the county, I'll make a brief plug for my newsletter. If you're not getting it already, there's a sign-up sheet. Every newsletter includes a list of volunteer opportunities that we know about. The other shameless plug that I will make is for another podcast that was just released where I talked with Daphne Wolf, who is the current president of the Winchester Orchard Neighborhood Association, and we talked generally about the value of neighborhood associations and why that's a really excellent way as kind of a starting point if the volunteerism that you're looking for is civic engagement, having a say in the policies that your city council or county board of supervisors are going to vote on. So I would encourage you to check out that podcast. And if it's volunteer opportunities with community-based organizations you're looking for, truly the best thing to do is Google it and say, I want to volunteer with animals, I want to volunteer to plant trees, I want to volunteer to hold neonatal babies. That's a thing. I recommend doing it that way. The opportunities are there. You just sometimes have to take that first step.
Perfect. All right, and the second question is, what do you think of the current proposal to remodel Elmwood Prison by demolishing buildings and building new ones and eventually constructing a new building for temporary housing?
For temporary housing. Let me tell you what we are doing, because I'm not sure about just those last two words. From before I got on the board, so the last 15 years or so, every few years a conversation pops up around a new jail. About eight or 9 years ago, I think shortly before I joined the board, one of our jails, Main Jail South, was demolished and taken down. We currently have two facilities, Main Jail, still called Main Jail North, but there's no Main Jail South, and Elmwood, which is more of a campus-style facility in Milpitas. The main jail is right next to the county building on Heading Street near First. So the buildings are in terrible shape. We have had a number of tragedies happening there, not the least of which was the murder of Michael Tyree by correctional officers. Michael Tyree should not have been in the jail in the first place. His reason for being detained was related to mental health issues. Be that as it may, there were two. As a result of that, we were sued by the Prison Law Office and by a number of prison reform and abolition advocates. And as a result of those lawsuits, the county was placed under two separate consent decrees, which requires us to make a huge number of improvements in our facilities. It doesn't flat out say you must build a new one, but the extent of the renovations that are being asked of us are not practical in the current infrastructure. In past iterations, the vision was, okay, build another jail. Just stick up a new building and it will have better lighting and more program space and maybe some murals, but it's still basically the same structure. The most recent time that came up was in 2020, and I think I was largely responsible, and you might think that's a good thing or a terrible thing, for putting a halt on that process, because what I said was that our jails are in terrible condition, but they exist. What doesn't exist are a sufficient number of mental health facilities across our community. And so with my colleague, Supervisor Lee, we brought a referral, because that's how you bring policies to the board, to declare mental illness and substance use disorders a public health crisis, which meant that this became the primary issue of the county. We did a study. We had the RAND Corporation do a study for us. They said that we need about 505 more beds, and you need this many locked acute, and this many subacute, and this many crisis residential, et cetera. We created a strategic plan. We have been, for the last 4 years, working toward adding all of those beds. We're about halfway there. So now that I am confident that that horse has left the barn, I don't know where that came from, and that we can't back up, roll back that promise and that work, I am more open now to revisiting the creation of better carceral facilities. And to some, better carceral is an oxymoron, and I understand that. We are required to have a place to hold people in custody. The Board of Supervisors has nothing to do with who's in jail, who's not in jail, who stays, who gets diverted, but we have to have a place. What has changed and iterated is that we're no longer talking about building a monstrous building. We are talking about looking at the footprint that we have at Elmwood, figuring out what infrastructure can stay, what infrastructure needs to go, what we have to build to better serve the changing needs of our population. And one of the reasons that we can do this, frankly, is that there are far fewer people at Elmwood because folks that used to be in the minimum camp are in the community. We're not holding, I say we, the sheriff, the DA, the judges, are not holding people for minor nonviolent crimes. So we have this space. The first thing that we're going to do is design a new booking and intake and re-entry center so that we can help process people faster, get them out if they need to be out, or keep them at Elmwood if they're going to be there for a longer time, because we can do more things with that campus to make it less traumatizing, more health-focused. We're going to invest at least half of the money is going to be in mental health and physical health treatments and dental services and all of the care that folks need. So we're building kind of a number of buildings. The overall bed count will be reduced by about 1,000 from what we have today, because we simply do not need that many beds. And I know that if we overbuild, someone will find a way to fill the beds. So that is the plan. You may have heard the $1 billion, $3.5 billion. There are multiple phases. The first phase has been literally ballparked at $1 billion. We don't have a specific design yet. We have no real costs. It's just the estimate based on square footage and the expertise of our facilities and fleets and people who know how much it costs to build things. The biggest question I got and we heard is, if you got $1 billion, spend it on prevention, spend it on this, spend it on childcare. Hell yeah, of course I would like to do that. And I hope that we can also do that. We do have a major deficit. In order to secure this $1 billion, we will have to take debt, a bond, a lease revenue bond, a GO bond. I don't know what that will be yet. But it's something that we have to do. If we're responsible for people in custody, they deserve to be cared for and treated humanely, and most importantly, returned to their home communities in a better condition in which they went in. And that is a tall order, and that's a way long answer, but I'm a little bit passionate about that. So thanks for the question.
We're going to try to keep sticking to how questions came in, so I'm going to pass this next question off. We'll go back to the cards. We'll get your question, and if anybody has else, make sure to keep them coming as well.
Yeah, and I would love if your questions are questions, like short questions, so that I can hear a lot of them. Hi.
Thank you so much for listening to us, and you explained all the childcare, because we are childcare provider. And
I know who you are.
We are part of apprenticeship or shared service alliance, so we are very familiar with that. But I don't know, like, what was your vision about to start that shared service alliance and how it work. I think it's a good idea to you just choose a 10 provider and then call your office and then ask them, like how it will work. Other parties like I came here for we have very low enrollment. This is not happening because family don't need it, because they are not given or informed, well clear understanding of their choices. So
Parents not understanding what their choices are?
yeah, because they think because it's a mixed delivery, just they have to go to the kindergarten, elementary school.
No, you're totally right. One of the things, and my team is actually working on a kind of comprehensive report of recommendations for how to scale this system at the state. One of the elements of that is kind of a marketplace database, bigger and better than the R&R, that would really be able, so that parents could see what all of their options are, providers could highlight when they have spaces available, just kind of a way to make it all much more transparent and support parents and providers so that you can match the funds or the subsidies with the availability, with the parent. I'm excited about that, and I will come back to all of you for some advocacy support when we kind of have a real idea of what that looks like. But thank you.
Yeah, thank
Then
you.
we can-
And on my
Sorry,
final
I want to make sure I get other questions, but thank you very much.
All right, the next question is after the rollover of UPK is done, what happens to the master plan and how can you help us get it?
Do that again?
After the rollover of UPK, what happens to the master plan?
Okay, there are a couple of the state has a master plan for early learning. It is a beautiful document. There is literally nobody in charge of it at the state right now. So, I know. We got a new governor coming in, and I have a few things to say about that. It's a great product, but it's not doing anything. I might need more explanation of the question. The UPK is the 3-year-old state preschool that is school-based. Universal Transitional Kindergarten is school-based. Those rollouts have happened. Those programs are fully operating. They have wreaked havoc with the child care sector, both center-based and home-based, because a lot of 3s and 4s have gone, understandably, to the free public school programs and have left their private providers with fewer children, less income, and very often the youngest, the 0 to 2s, who are very cute, but also very expensive and have lower ratios, more costs associated. So there are absolutely ongoing problems. And while there was good intention by the state for creating universal PK and TK, it did not take into account the childcare system that did exist, didn't take into account the fact that these are not full-day programs, so it means more patchwork for parents, and there's a lot of work to be done. San Jose also has an early learning and master plan, and they are doing a little bit more with theirs, and they are working with the county, and I understand maybe part of the child care blueprint.
This next question is a little bit of 3 parts. I'm going to put it into one cohesive question. It's more so asking how university students can be involved with the EFCS, if there are scholarship programs, other philanthropic groups that high schoolers, university students can take part with.
High school students can apply for internships in the county. The particular intern and earn program that I mentioned is specifically for former foster kids. Our priority is to give opportunities to kids who don't have a parent who knows a council member or knows a business VP and can get them an internship. That's their program there. The supervisors have internships. Going through your high school, I think, is the best way to do that. When I worked at the Chamber of Commerce in San Jose, we created an internship program that worked with school districts. I don't know if that still exists at the Chamber anymore. College students and the connection with DFCS, if there are college students that are studying to become LMFT, licensed marriage family therapists, there are absolutely pathways to come and work at the county. In fact, you need to get clinical hours, and we have partnerships with the universities. I think that's the best I can do on that.
Next question is, where are we currently with the state of our budget and the ongoing impacts that it has with child care programs? Will new initiatives be able to continue?
So let me take the first part first. As long as HR 1 is in effect, our budget is going to be drastically impacted. We had to close last year. We are required to balance a budget on June 30th. We had about a $700 million gap that we had to close last year, which we did through a combination of factors. It is going to be even bigger this year because some of the Medi-Cal changes, Medicaid changes, will be operationalized January 1, 2027. So we will be hit even harder. But let me note that it is not just the federal government. We lost state funding for Medi-Cal only. The program that Governor Newsom rolled out with great pride years ago to expand healthcare to residents with uncertain documentation status, first to young children, to older adults, to teens, and finally to that middle 19 to 64, that was phenomenal. Between that program and the Affordable Care Act subsidies, California was almost at universal health care. The subsidies are gone, so people are losing insurance that were supplemented to buy from the commercial insurance through the Affordable Care Act. And a lot of that Medi-Cal only expansion for the UIS population is being pulled back. So this is going to result in so many more Californians being uninsured again. They will come to hospitals, public and private, to emergency rooms, because that is the only place you can get care if you don't have health insurance. And I'm deeply concerned about that population overwhelming emergency rooms, which impacts all of us. If you have a longer wait, a longer ambulance response time, fewer specialty care services, it is a problem that impacts all of us. Counties this year asked of the state for support, money for public hospitals, for indigent care, for eligibility workers, so that we can have more people help folks stay on their insurance. We did get some great funding for eligibility workers. We got one-time funding, $250 million, with many thanks to two of our local assembly members, Ash Kalra and Patrick Aarons, who really drove that through. It's $250 million across the state. It's not life-changing, but it's better than we would have gotten without them. One-time funding and no indigent care funding. So we're already gearing up for another year of really fighting for health care funding. So our budget will remain in those dire straits. Sustainability of the programs, I tried as I walked through each program to show you how either through Medi-Cal funding with doulas or moving programs to the County Office of Ed or First Five, that we are kind of incubating programs at the county and then seeding them in other organizations. But it will still continue to be patchwork until we have continued sustainable ongoing funding really at a state level. This isn't a challenge each county can address on their own.
The next question is, if the TK credential program is still taking applicants, and if so, how does someone go about applying?
Please take a card, and we will connect you to my office tomorrow for someone who knows how to do that.
Next question's here.
Hi, this is Manmeet. I'm a childcare provider. Why, if you have worked so much with different programs, why is still childcare suffering, the providers are suffering with the low enrollment? That's my first question. And the second question is, I would love to come in person in your office, bring my childcare provider, and tell you what goes behind the scene and how much we are suffering after being educated from our country, having bachelor degrees, doing so much work. Our kids are being sent to pre-K and TK for what?
I know.
Like, we don't think that, these things are being right. And we worked with Share Alliance. If a parentship program worked so good, why would the teachers work with us? If we prepare our teachers for the parentship program, will they work with us or will they go away to school?
That's a great question. Many of them, Chris will take the mic back. Many of them will go to the TK programs because it pays better. It's full-time work. School teachers get insurance. Of course you need more enrollment. What we have done in the county, I am proud of, given the limited dollars that we have, what we've been able to achieve. We're in no way meeting even half of the existing need. These are little drops. The solution has to be a statewide child care, if not national, system that acknowledges not only the need for vouchers, where the state has done a great job, vouchers, but we also need funds for facilities and we need a workforce. And if people are going to leave childcare to go to the TK system, nobody thought teachers were super well paid to begin with, but they're paid more than childcare providers. We need a continuing supply of teachers for the early childhood education as well. I share your frustration. We are nowhere near where we need to be. Yes, I'm going to get some other questions. Thank you. Vicki? Is that Vicki?
Yes. I just wanted to add that layered onto this issue.
Can you wait for the mic, hon?
I
Thanks.
just wanted to add that layered onto this issue is declining birth rates. So not only do you have the TK and PK, but we also have fewer children while we're increasing TK and PK. So it is a multi-layered problem.
Thank you. That's a really good point. Declining birth rate and families leaving because it is so expensive, because there's not sufficient childcare. It is a really vicious circle. There is a model in Solano County in Vallejo. I'm speaking to my school board members right now, called Rise Vallejo. And the county and Head Start and a couple of organizations came together. They bought an elementary school that had been shuttered, and they have turned it into this amazing co-op model where I think Head Start is using about 11 in the classrooms, but beyond that, teachers and providers can lease 1 or 2 or 3 classrooms. The whole place is licensed. It has all of the required outdoor spaces and specs, and it's a great way to incubate a small business. Maybe you grow bigger. You have a community of practice because you're all in the same place. And while I don't wish school closures on anybody, if that is the case, we should be looking at models to repurpose them for childcare. And that also may take away some of the tension between the TK, pre-K, and childcare providers. What else? I think we've got about 7 more minutes of that clock, if I'm right in reading it.
Hi, Susan, Supervisor Susan. My question is, I'm a childcare provider. My question is, why did we spend a lot of money trying to work on master plan and nobody's taking care of it and it's not active on the system? And I know that I was part of the work that was done, and I believe because we are not included. So people that were working over there, they work in offices. So they were not childcare included because we work on the ground. So they were not good input. That's why we see this mess. We had a lot of doctors from psychology and all over the state, but they're not the people that are on the ground. They are not in the classroom. They are not on childcare, center or whatever. So whatever they took from Massachusetts, because that's why they're thinking it's gonna work for mass health, whatever over there. DSS, California is not Massachusetts.
Nope.
And that's why we have a lot of flux, and we want to have that master plan. Because I want a childcare provider to read. I have a copy, but I want everybody to have a copy and read. And I think if we all read it and we come back together, because it had to be amended. There's a lot of stuff that need to be amended. And then that will be a work of master plan, because that master plan was work only with people from the top, not people from on the ground.
Thank you. Thanks for the
Yeah.
feedback.
Thank you.
Appreciate that. Other questions? I have fully sated your curiosity. All right. Then again, thank you so much for coming. Grab any sandwiches that are left, and we'll do this again on a different topic, I think in about 3 months. I don't know what that is yet, but you will definitely find out. Thanks, everybody.